At this point, I went over the patient's chart for any significant findings, data, and patient history. According to the physician's order, this patient needs to be extubated today. I've already looked at his current FiO2, and I've gathered my belongings, which includes an emergency intubation tray. It has my gloves, my ET tube holder, my ET tube, my CO2 detector, my mask, along with my manual resuscitator, my stylet, my 10 cc syringe, and my laryngoscope and Macintosh blade. I also have my stethoscope ready. Okay, I've also gathered my belongings for extubation, which includes my manual resuscitator, my vacuum, which is set at -120 to -150, my oxygen source, my aerosol mask, my closed suction catheter, my 10 cc syringe, my pulse ox, and I also have a chuck on the patient. So at this point, what I will go ahead and do is wash my hands and introduce myself to the patient. Hi, my name is Brittany. I'm a respiratory care student, and I'm here to extubate and move your tube. Is that okay with you? Great. All right, so at this point I will go ahead and verify the patient's name and date of birth. Make sure that's the right person. I can look at his band also. And after I verify his name and date of birth, I will go ahead and check his pulse ox, his heart rate, and his respiratory rate, and make sure that he's responsive by asking him to squeeze my hand and maybe wiggle his toes. Okay, and at that point I will go ahead and suction each side of his mouth, on each side of the tube, the ET tube. Okay, great. Now that I've done that, I will go ahead and suction. And I would also, before this process, I would pre-oxygenate the patient with my manual resuscitator. And if the patient's on a vent, then I would just push the button for oxygenate. Okay. Now I'm going to go ahead and remove the ET tube holder. Oh, and I'm going to deflate the cuff. I would ask the patient to take a deep breath to abduct the vocal cords as much as possible on the peak inspiration. Could you take a deep breath for me, sir? Okay, great. At this point, I will go ahead and check for stridor and put on his mask so that he can get some oxygen. And I would have it set at the FiO2 that he was currently on. According to the chart, it was 40. Okay. So I'm going to go ahead and check for stridor. And as you can see, my patient is in the high Fowler's position for the whole procedure. Okay, great. I would check the patient's pulse ox saturation once again, his heart rate and his respiratory rate all once again. And if he did have stridor, if it was severe, there's mild, moderate, and severe. If it was severe, I would go ahead and re-intubate. the patient right away. Okay, so at this point I will go ahead and wash my hands once again.